Back in the day when I was in school, every summer, that is around February, March, April months, if there was a school assembly that was happening, there was for sure this one kid who would collapse because of a heat stroke. Now, what is a heat stroke and why are we here at PRS Neurosciences talking about heat stroke? We usually deal with the different other kind of stroke, which is a brain stroke. But that's the whole point of this video today. What are the differences between a heat stroke and a brain stroke, and how can you differentiate the two of them? Welcome, this is PRS Neurosciences. We are a neurosciences company based in Bangalore. We make videos on this channel to create awareness about everything related to the brain, the spine, the central nervous system, and all the other neurological conditions. So make sure you're subscribed and hit the bell icon, because these videos are going to be extremely helpful to you at some point in your life. Let's first understand what is a brain stroke and what is a heat stroke. What happens during a brain stroke is that your brain is deprived of oxygen. This happens because of two reasons. One, there could be a clot, which is restricting the flow of blood, therefore restricting oxygen. The second way is that there's a hemorrhage. Hemorrhage is a burst of some sorts in your brain, which again restricts the flow of oxygen. What this essentially does is your brain can go without oxygen only for a few minutes. After that, you start losing brain tissue, brain cell, brain matter, which is quite irreversible, right? That is the risk of a brain stroke that you really have to act on time, because or else losing your brain literally. But what is a heat stroke? In a heat stroke, what essentially happens is your body overheats, like how your phone overheats. Now this could be because you are standing out in the sun in a higher temperature for a prolonged period of time, or because you have exerted too much physically, right? You've done some running or played some sports again in a high temperature under the sun. So that could lead to a heat stroke. Now, how do you differentiate? If you are a person who's in a field and you see somebody collapsing, somebody needing help, and you need to make a call whether it's a brain stroke or a heat stroke, how do you differentiate? You differentiate based on the signs or the symptoms. When a person is having a brain stroke, there are these classic signs which is reduced in the acronym Be Fast. Check out our videos to know more about it, which is essentially balance issues. This person will not be able to walk properly. E is for eyes, vision. They start having blurry vision, or they're not able to see, or there's a blackout, or their vision is definitely affected. F is for facial symmetry. Their face starts drooping from one side, or starts to get pulled to one side. A is for arms. If you ask them to put up their hands or arms, they won't be able to put it up, or they'll have some sort of a weakness doing that. And the last one is speech, which is slurred speech. They're not able to articulate properly, they're not able to speak properly. These are the classic signs of your brain stroke, and we have made numerous videos covering this with neurosurgeons and neurologists, because these are such telltale signs, yet people seem to miss them. And the most important thing here is the T at the end of Be Fast, which is time. Like I said, you're losing brain matter for every second, every minute of a brain stroke. So it is really important that you use that time effectively, efficiently, and act quickly. So those are the signs of a brain stroke. And what if you don't see these signs? What if you see another set of signs which can help you determine if it's a heat stroke? Let's go to that. Essentially, in a heat stroke, what happens is that your body temperature rises. Like when you have a fever, right? You can feel your body being very, very hot. That is one of the telltale signs. The second one is rapid heartbeat. Your heartbeat increases, your skin sort of flushes out, you become very pale, and there's usually confusion or agitation. They are shaken up in a particular way. And if there is nausea and vomiting, if there is a combination of these signs, it could be a heat stroke. Now that is the difference between your brain stroke and a heat stroke. Now that we've seen the symptoms, you're able to draw that clear distinction where your brain's issue or the brain stroke is essentially no oxygen to your brain. But the heat stroke is basically your body being not able to regulate its own temperature. Now, why is there a confusion between the two of them? Because they may present in the same way, right? If you suspect a brain stroke, you need to rush to a stroke-ready hospital within the golden period. Now, two big words: stroke ready hospital, golden hour. I'll tell you what both of it is, but we have made videos before in which both of these things are very clearly explained by professionals. I highly recommend you check those videos out. They will be linked somewhere here. Now, a stroke ready hospital is a hospital that has all the essential tools and departments that you need for a stroke patient. That is an MRI machine, a CT scan, MRI with the sequence that is required because there are different MRI sequences, right? And a dedicated neurosurgery department. Neuro, anything to do with the brain. If you need a surgery, they should be able to take you up to the OT quickly. So a stroke ready hospital has these and many other more advanced techniques in which they can help you in the fastest way possible. So time is brain, brain is time. This is something you have heard us tell on our channel again and again. So make sure you rush the patient to a stroke ready hospital within the golden hour. The golden hour is a period of time in which your brain is still salvageable. Like I already said, brain damage is almost irreversible. It is unforgiving. So acting on time with brain injury is very, very important.
If someone has a heat stroke, lay them down, keep them cool, and let them breathe comfortably. While you do this, call for medical help. Any hospital with primary care can handle it. Heat stroke is serious too and should never be ignored.
We hope this video helps and we hope it was valuable. If you have any more questions, please do leave them for us in our comments. We definitely read through each and every one of them. If you have any suggestions, any more topics that you want us to cover in this channel, please do let us know. And that was the video for today. Heat stroke versus brain stroke. How do you differentiate? I hope it was a quick crash course on everything that we spoke about. Again, if you have any doubts, please leave them in the comments and one of our experts will get to answering that. Having said that, don't forget to like, comment, share and subscribe to the channel. I am Yashaswini Sunil and I'll see you in the next video.